Hello, my name is Jeremy Bogan, and today I will be sharing details about my internship experience. This presentation is being submitted in partial fulfillment of the requirements for HED 598, which is internship in health education in the Department of Health and Kinesiology at Mississippi University for Women. Before I reflect on my internship experience, it is important that I summarize the purpose for completing the internship in addition for fulfilling requirements for the course and the graduate program. The benefits of the internship include gaining real-world experience in the field of health and education that cannot be afforded to me in the classroom and networking with active professionals in the field. Other benefits include, but are not limited to, improving my resume to reflect my experience, first-hand practice with implementing health education programs related to health and fitness, and impacting the community I care about. In this case, that would be the Mississippi Gulf Coast, which is where I was born and raised. With that purpose in mind, I began performing research to determine the best location to gain the experiences I was looking for. After extensive research, I chose STEPS Coalition. Located in Biloxi, Mississippi, the STEPS Coalition accepted my proposal of being an intern there for the months of January 2016 to May 2016. Before we talk about my specific duties at the STEPS Coalition, it helps to introduce the organization itself. STEPS Coalition is not for a profit organization based in Biloxi, Mississippi that serves Harrison, Hancock, and Jackson counties. STEPS Coalition, also known as simply STEPS, is a grassroots, locally governed coalition of 45 nonprofit community and civic organizations and leaders whose mission is to build a democratic movement to create a healthy Mississippi Gulf Coast. STEPS advances its mission by developing local leadership, supporting communities to advocate for their needs, and by facilitating communication, coordination, and collaboration among our membership. The vision for the Mississippi Gulf Coast is to create communities worth calling home. Creating communities that are worth living in for all residents along the coast is the ultimate goal of the coalition. To do this, they have pledged a commitment to five essential values. There are affordable housing, economic justice, environmental justice, preservation of historical communities, and human rights. Although there are a number of issues discussed at STEPS Coalition in the health educational environment of the Mississippi Gulf Coast, my assistance to different degrees were requested in the following programs. Coastal Women for Change, which is dedicated to women health issues. Coastal Family Health, which is dedicated to family health and prevention methods. Alliance Institution Gulf Regional Health Outreach Program, which is geared around building sustainable communities and creating equal access to healthcare. The Mental Health Association of South Mississippi, which is dedicated to promoting importance of mental health services and providing equal access to said care. And the East Biloxi Community Collaborative, which hosts health cooking demonstrations, fitness in the park, healthcare enrollment, and encourage health decline prevention methods. Of the five previously mentioned, my interest and input were greatest with the East Biloxi Community Collaborative, also known as the EBCC, and Coastal Women for Change. Let's talk about my specific involvement. When it came to Coastal Women for Change, I admit most of my input here was with planning and research, and most of the major requirements of the program had already been fulfilled by the time I came along. So I was invited to help plan how to promote the community garden and its purpose in the city. I was also invited to help with administrative duties, like printing, running reports, and handing out flyers to promote the human health conference. At the actual conference, I was asked to participate at the booth by handing out brochures and more information about the coalition and how it helps women in the community from everything from issues related to children and family to things related to sexual health and overall well-being. The picture you see here was taken at the Women's Conference where we invited women to participate in arts and crafts to help us design logos for future events. My highest interest in childhood obesity. As such, I was most excited to help the Coalition East Biloxi Community collab with every activity they perform to fight its rights in the Mississippi Gulf Coast. My favorite activity was hosting fitness days at the Boys and Girls Club. We scheduled regular exercise activities that were fun for kids and offered them healthy lunches. We also hosted quick seminars to teach them about the importance of diet and exercise. We also hosted fun days for the entire family that included sports like basketball and baseball, races, and more. Other highlights with the ECBB include their health conference and community health fairs that invited health companies to come out and advertise their service to local residents. And the City Hall meetings where I assisted the Director of Engagement, Jaleesa Nicole Walden, with collecting data and performing research for her Biloxi City Hall presentation that addressed the city's condition of air due to city road workers causing air dust. I got to see firsthand how much work goes into collecting data from something like that when you are trying to appeal a local lawmaker. I found that to be a valuable experience. My time at the Steps Coalition had me fulfilling many roles. I did a lot of administration work to help ease the paperwork pressure of the people doing the planning. I participated in meetings that helped plan and research all the city's events to draw residents out for health education. They included community health fair, Boys and Girls Club activity days, and more. I also enjoyed my job shadowing. Before my input was requested, I was invited to follow the employees on their jobs for a day just to see how much goes into it. This was also done for me to learn office culture. I can say without question that this was the best part of my entire graduate experience. I know one can read about a job and its requirements, but there is nothing better than experiencing it firsthand. Getting to see the people you are impacting in person is extremely fulfilling, and I'm glad I got to do it. I like working with the people directly and planning outreach. I did not like, however, not being able to perform any research after the fact to see how our efforts impacted them, but I will carry on in the field by applying all the things I've learned. Thank you for listening. Again, my name is Jeremy Bogan, and this presentation being submitted in partial fulfillment of the requirement for HED 598, which is internship in health education in the Department of Health and Kinesiology at Mississippi University for Women. Thank you.